technical working group is really competent, having interacted with them in the WHO environment, and I think we can work together with the multi-sectoral approach to ensure that we have transparency and accountability, open tenders, among others. We may also consider using external bodies to monitor and ensure that we have no challenges in that. And leveraging on technologies, I believe it's time that Kenyans embrace telemedicine and also embrace the digital platform as discussed earlier.
Junet.
Thank you, Chairman. Chairman, my question to Dr. Deborah is, Madam Nominee, as you are aware, health is majorly a devolved function. Health matters happen at the county level. But the problem this country has encountered for the last 10 years or so, since the new constitution and that devolved health functions, is because there is no seamless working system between the national government and the county governments. It is devolved, but you'll see a lot of things are happening at the national level. All the complaints are at the national level, and these things are supposed to be at the devolved, because the dispensary at the village there is what matters. So how do you intend to make sure that you health is really devolved and resources are taken to devolved units so that people can get the services at the road there, I mean at the village there? And my last question is, you can see health, the number of medical students also are increasing, and the number is becoming big. There are more health workers that are being trained, even as doctors. But the institutions that are training them now are becoming deplorable, in a very bad state. Do you think that will compromise the quality of healthcare or the quality of services Kenyans get? Thank you very much.
You may proceed to answer.
Through you, Honorable Chair, I would like to respond to the Honorable Member regarding the health, the devolved government. So again, a consultative approach. I believe we need to involve the national team as well as the county government to have open dialogue and come up with interventions. We need to look at the situational analysis and see where are the strengths, the weaknesses, opportunities, and threats. And from there, we need to come up with priority interventions as the county begin. Another thing that will ensure seamless flow of information and also to ensure monitoring from national level down to facility level is the health information system, a digital platform, so that the reporting system is picked up and goes to the national level and also trickles down to the facility, as well as tracking and monitoring of infectious diseases, quality of services, and also addressing the matters of corruption. So again, it will be critical for us to embrace the digital platform in this case. Regarding the medical students, what I would say is the health workforce is a critical pillar in health systems. All our health workers are important. The doctors, the nurses, lab technicians, physiotherapists, nutritionists, among other cadres. And let's not forget the morticians and the cleaners who are frequently forgotten. And I think it's critical to say that during COVID-19, we saw that these cadres were actually disproportionately affected by COVID-19 and even other infections like tuberculosis and Ebola. And so we need to strengthen our health workforce. With the numbers increasing, I believe, again, it's a consultative effort. We need to bring unions on board. We need to bring professionals on board, the doctors on board, and come up with strategies and areas of improvement. We also need to strengthen our regulatory system to ensure that we are bringing out doctors and other health workers or professions who are qualified, because we are also thinking of these doctors or nurses and other professions working outside Kenya. So we need to ensure that we are providing quality, top-notch quality and highly experienced health workers that are able or capable to work in the in other international spaces.
Thank you, Chairman. Dr. Deborah, my question is that the instances where doctors have been going on strike have risen, with the recent one being the interns in July 2024. And we know what that means, especially to the Kenyan populace. I'd just like to know how, moving forward, you'd like to resolve this issue, looking at the root causes so that it doesn't recur. And also we have the community health promoters, where they're also saying that there's stipend delays, it is low. How do we just ensure that people who work in the health sector, because it's a very important sector, are taken care of in terms of their remuneration and also their welfare? The last question to you is that whether you understand the magnitude of the ministry that you will be leading. You have very critical departments and areas. We have KEMSA, you have the malaria control, you have the AIDS council, you have the ministry itself, you have a chief, you have all that. How will you ensure, or what leadership skills will you use to ensure that the policies that you put in place, you implement, cascades to all those departments, and not, because we see in health department and also some of the big departments in this country where a CS just wakes up one morning and start issuing different directives, right, left, and center. I would like to know what leadership skills you will use to ensure that does not happen.
Go ahead and answer.
Through you, Honorable Chair. And thank you, Honorable Member, for the questions. So indeed, the doctor's strike has been a challenge over time in immemorial, and every cabinet secretary has dealt with that challenge. And so there's need to look for long-term solutions. I believe that the long-term solutions are with us. So we need to work together with the unions, the doctors themselves, the interns. We need to work with the bodies, the Ministry of Education, among other stakeholders, to come up with a solution. I don't have a solution, but what I am seeing is we need to have a situational analysis and be able to develop action plans following that. There is a Doctors Interns Act that I believe is ongoing, and I think that is one of the areas we can start with and strengthen. Equally, there are the return to work formulas that were given to the doctors, of which we can implement with support from Treasury and other sectors. Regarding the multiple departments, I would want to run the office with high integrity. I have seen that we have wonderful national technical leads in the office. We have DG, we have the PSS. I believe by having weekly meetings and sharing reports, conducting monitoring and evaluation routinely, we can be able to strengthen this. But we need to align it with the national strategy and the MTP plan, identify the priority activities, the timeline, and the budget. And if the Treasury is able to provide the budget, then we can implement. And also based on outbreaks that are at hand. As you are aware, there is a monkeypox outbreak, and also we need to ensure that we are prepared and ready to respond to such outbreaks.
Nelson.
Thank you, Honorable Speaker.